All right, so we'll get started. It is 2 minutes after 6, and we'll get started with the DESS Web Implants webinar. So, first off, thanks for joining and being interested in our newest venture. Our implant launching and line. Hope you find it informational. I'm going to present. I'm going to slide whip you to death here for about 40 minutes or so, and then we'll stop and make sure we answer all of your questions. Additionally, we'll be able to send a recording of this out, and then additionally to that, we'll be sending some implant specials out to those in attendance as well that you can take advantage of as a thanks for taking your valuable time to attend and learn about what we've got to offer. So, with all that, I'll get started. First, I want to introduce who's talking to you. For those that may not know me, my name is Darin Lockaby. I'm going to tell you a little bit of personal and certainly some professional. So I'm the president here at DESS USA. I've been with DESS a little bit over a year. Joined September of last year, so now I can no longer claim the new card. I can't pretend like I don't know what's going on. I tried that for a year, but that time is up. So who am I? I've been married to my bride Dina for 32 years. We have four very rambunctious kids who, this is a picture from about 10 years ago. They are much older now. My oldest is 31 and my youngest is 21. So I have 3 boys and a girl pancaked in the middle of those. What do we like to do? We like to travel. So, we've been to Europe is our where we find real enjoyment. So, we work, we all work to provide a living and do things we enjoy. We work so we can, spend time with our kids and go, see places in the world. Bottom left picture, we're a super competitive family. I love sports, anything with a ball. I'm interested in anyway. So, we really are a competitive family, but that's me, personally. Professionally, I've been in the dental business for a little over 20 years. Almost all of that is in the dental implant realm and the dental lab business. I started out with Nobel Biocare a little longer than I want to think about. I spent some time there. I then went to Astra Tech Dental. And that became Dentsply implants, which then became Dentsply Sirona implants. I spent probably 12 years there, and I joined DESS again about a year ago, and so I've been with some large companies and led large commercial teams, and so you might be asking, you're going to hear this as a repeating theme throughout the presentation. Why would you go to a smaller company like DESS? And I'm going to tell you, it's because we have really high quality products, and we're differentiated in many areas versus some of our OEM counterparts that will bring value to you and more importantly your patients. And lastly, we do it in a way that's more affordable. We're all running small businesses and looking for ways to make more money without having to work a lot harder and longer. So we sell these products to you at an affordable price that allows you to make more money or allows you to pass some of that along to patients to attract more cases. And we allow you to do that without sacrificing any quality of care to the patient. So that's why I'm here, and that's the DESS story, and I hope it resonates with you. So we'll start. DESS has been in the dental restorative products business for 20 years, and making dental implant components and prosthetics for multiple implant systems. So why are we now offering implants themselves? So I want to explain that why. Yeah, the elephant in the room, not going to deny it. This is a new opportunity for us to increase our presence in the dental market and increase our revenue. It's without a doubt that. But it also allows you to deliver more value to your customers and your patients. And that's ultimately we're in business for you. And so if you're successful, we're successful, but, we want to complete our portfolio here. Next, we've been making products, very precisely manufactured products, for a long time as well. And so we want to take advantage of that core competency that we possess, to really take advantage of that, so you can provide better care for your patients, and consistent better care for your patients. Next, we've got state-of-the-art machinery. We've got rigorous quality control in our manufacturing process. So this really leverages that, again, leverages that, one of those core competencies that we have of machining capability and quality control. And I'll tell you, I'm going to show you pictures of some shots of our plant, our milling facility in Barcelona, Spain. We use state-of-the-art machinery. When you walk in, it's as far as you can see, it's milling units, and they're high quality. We visually and digitally inspect all of our components to give you confidence that what we're giving you is going to meet or exceed the OEM part you're trusting us with, and provides you consistent quality. And we do all static and in motion fatigue testing. So all of our products are FDA approved. We go through all the same testing that the OEM products go through, and we compare to the predicate device. Now, I want to tell a quick little story here. One of my roles when I was with Dentsply was I was the director of sales for our digital business, which included our Atlantis abutments. I'm sure most all of you have, if not used Atlantis abutments, know about them. And I also manage our Simplant business, our guided surgery business. So I've been in the Atlantis facility. I worked in it for probably 5 years, and so I know what a good milling facility looks like, a milling center looks like, and Atlantis it's a very, very good, high quality milling center. And so when I was interviewing with DESS, these are words on a page. You don't have to trust me, but if you ever get a chance to visit Barcelona, we'd love to show it off to you. I interviewed with DESS. I went over to Barcelona and toured the facility, and comparing it in my mind, I was going over with the Atlantis facility in my mind, a picture in my mind, and the DESS facility is better, easily better, hands down better. And I tell you that as yes, an employee, but when I went into it, a skeptic. So the pictures you're seeing now of our facility are in real life better. It's a fantastic facility. So just know what you're getting is quality products. We want to build on what we've been providing you guys, our customer base, and really provide take advantage of those core competencies and provide you a one-stop shop. So build on our trust with you. And just wanted to, these are some of our customers that have visited the site, the facility in Barcelona, and there's a lot of smiling there. And I don't know, for those of you that have not been to Barcelona, I will tell you it doesn't suck. It is a great place to visit. So if you come just for DESS, that's great. But there's a lot more to do there. We're proud of where we manufacture our parts. So we want to make high quality implants. You're going to hear this as a repeating theme here. We make high quality parts for you, and dental products for you. Our implants are no exception. They are going to be no less than the predicate, if not better in some respects. But again, we're going to give it to you at an affordable price, so you can control your COGS. And again, you're business owners. You don't do this for a hobby. You're looking to provide revenue for you and your families, or whatever you like to invest in. So we want to do that. We've also done some really neat stuff that we're the only one in the world to do, that I'll share with you in just a minute, about. We're a zero waste implant, and I'll go into detail in that in just a second. So where have we started? And we've really started with the two most popular implants in the world, and certainly in the U.S. We've started with the Active HEX, which is a great immediate load implant. It's good for soft bone for sure, extraction sockets. A little short story here. I was actually with Nobel when this launched. So I remember taking the implant and screwing it in my thumb upside down, and it would hold like it was stuck to Velcro. It's got bite to it. So we started with the Active HEX. We also are adding the CONICAL BLT. So one of the things you'll notice here is the external and internal design functions of each of these implants are the same. So, again, that takes precision. It takes the ability to consistently do that and then prove it to the FDA. So both the internal aspects of these implants, so the connections, you can feel confident are the same, as well as the external properties which interact with the bone, are the same geometries. So those are the two systems we've started with, and I mentioned this a second ago as a teaser. We've done something new that I believe we're still the only one, and we have created this zero waste implant. So what does that mean? It's a tagline. What does that mean? So I'll let the video explain it to you.
We know that small actions lead to great changes. That's why we bring you the first zero waste implant on the market. Once you've placed the implant, do not throw the packaging away. Keep it in our return boxes and we'll handle the waste. We recycle both managed forest cardboard boxes and plastic blisters. And we reuse every titanium vial according to all the cleanliness and sterility guidelines. We can't be more grateful for your help in taking care of the environment for a more sustainable world. So we want to give you a free implant for every 10 packages you return. Are you ready to join the circle?
All right, my colleagues are telling me there's no sound, but basically what that means is what that video was telling you. You could probably follow it at least. Every component of our implants are recyclable. So the box that comes in is recyclable. The blister pack is recyclable, and the part the implant comes in, the vial, is recyclable. So as you use them, we can provide you with a box. You keep all of that excess material that you don't use. Put the implant in the patient's mouth still, for sure. But take all the blister pack, the box, and the vial. And if for every 10 that you return to us, we will provide you with a free implant. So again, it's being environmentally responsible. It's helping with cost with recyclables, and it actually provides value to you because you get a financial benefit for it. As if you provide that with us, for us, we provide you with a no charge implant to place. So this is the first real implant focused on the environmental impact of plastics and cardboards and titanium vials, and we're proud of it. And more importantly, I just want to, why should you look at, okay, great, zero implant weight, why does that matter? Well, if you're serious about the environment, you know why it matters, and if you're not, nobody likes a bad environment, so it doesn't hurt to recycle it. Second, the recycling allows us to reuse and others to reuse that product again, so we don't continue to add additional waste, and it helps keep our packaging costs down, which helps us keep your cost down. And then, of course, thirdly, we give you, again, one free implant for every 10 you return. I want to talk about another differentiator with DESS that, I think is important. So yes, sustainable zero waste implant. Yes, we recycle. Yes, it's high quality. It's made just like the OEM, external and internal geometries. Yes, it's really high quality, taking advantage of all our expertise and our competencies. Yes, we're going to give it to you at a more affordable price. Um, but you also, we have what we call pure switch. So what does pure switch mean? In its essence, it means if you have invested in a NobelActive kit or NobelActive restorative parts, or you have invested in a Straumann BLT kit and a Straumann BLT restorative parts, prosthetic tooling, you can utilize those with our implants. So you don't have to go through the expense of, one of the obstacles to change an implant system is, oh, I got to buy new tooling, I got to buy a new kit. That's expensive. And do I really do that to save a little bit on an implant? In our case, we're going to give you again that high quality implant. But you don't have to change your tooling. We have tooling available for you if you need it or want it or desire it, but you don't have to. You can utilize the OEM products, tooling that you already have in your office to place our implant. So really the only switch is, hey, I'm gonna get equal for less. And I know we all talk about price doesn't matter, and it's never usually not the leading thing, but it is important. And so we again want to partner with you so you're successful, we're successful. So pure switch. When you see pure switch, that's what that means. So how can you be confident, that the implant's going to osseointegrate? What are we doing for surface technology? I have spent time here, so I can certainly. So we use osseointegration surface technology. What is that? It's a made-up acronym by DESS. It's something we can market, so we call it OST. What is it? It's SLA. It's an SLA standard surface that we utilize for our implants. So we sandblast them with alumina particles, and then we double acid etch them. Trying to say that fast twice in a row is difficult. And these surface technologies, that SLA standard has been around. There's tons of studies on them. We're doing nothing really new here. So we're using predicate device studies, but we use that same procedure to make sure these implants integrate, and they integrate as quickly as you want them to. If you're doing immediate load, great. If you're doing delayed load, great. If you're doing, the traditional, let's let it heal 3-6 months and come back and restore them, that's okay too. We can accommodate all three of those. So again, we sandblast with alumina particles. This gives you that macro roughness on the surface of the implant, which is important. And again, it matches SLA standards. We then add to that the double acid etch, which gives you the rougher topography, that micro roughness, which is really more ideal for that cell adhesion, for bone attachment, for bone growth. So you get good implant to bone contact and good long-term success and stability with your implants. So that's what our surface is. Again, OST, it's osseointegration surface technology. It's an SLA standard surface treatment for you, so you can feel confident the implants will integrate, bone will attach to them. You'll have good soft and hard tissue response, which ultimately leads to successful restorations, which is what your patients come to you for. They don't care about the implant and the surface. They want a tooth. So again, it's documented, well documented. The SLA surface treatments are. So how do we position? We are our quality. I would put up against any of the main implant providers, any of the OEMs. I would again, I would put us side by side against any of them, with the added advantage for you that while you're not giving up on patient care, you're not giving an inch on patient care. We can be up to 50% more affordable, in some cases more than that. So again, it's allowing you to use a trusted partner with expertise, making consistent really high quality products, and allowing you to control your costs, so you can be more profitable, pay your staff more, take vacations, provide great care for your patients, and that's really what we want to partner with you on. So again, positioning is equal quality at least, with certainly some savings for you. We do everything through FDA standards, so we are 510(k) registered with every product we sell, whether it be implant related or restorative related. Every product we have goes through that 510(k), that 510(k) certification. And if I'm sure you know this, but if you don't, what that does is to get 510(k) clearance, you have to compare to a predicate device and prove that your device is at least equal to, if not better than, that predicate device. So in this case, we would have been filing with the FDA versus a Straumann bone level tapered and a NobelActive HEX. So in summary, we're going to give you those high quality products at a better price with Pure Switch, by the way, if I haven't said that yet, which again allows you to use your parts and pieces, that you're tooling, if you have them, or we can sell them to you as well, and again at an affordable way. And that predicate device, we prove substantial equivalence with it. So again, they're safe and effective to use. We have the 510(k) clearances on all of them. So I want to provide a little bit more specifics of what our offering is with each of our implants. So I'm going to go through a little bit of detail on the Active, and then a little bit of detail on the HEX, and specifically on what our offerings are, implant sizes, drills, those type of things, what the drilling protocols are. So I'm sure you can't hear the sound on this, but I'll let the picture kind of show you what our Active HEX looks like. Again, the internal and external geometries of the Active HEX are exactly the same as the NobelActive. So I'll let you look at the pictures, and I'll be quiet for a second. So again, I know the sound isn't working. I hope that was a good explanation. Again, internal and external aspects of the implant are exactly the same. So you see the internal connection is the same. You see the cutting threads, the dual cutting threads, the reverse cutting threads of the Active are the same. I think and I'll go over just a couple of the differences that you probably saw there that don't have to do with geometry in just a second. So that's what the Active HEX looks like. We have the same exact platforms and links as what the OEM brand offers. So, if you're accustomed to placing 3.0s in those congenitally missing laterals, and you're accustomed to placing the wide platform 5.5s in, molars, we have them all in the same links, all in the same restorative platforms, all in the same widths. So we offer the same thing that the OEM does. We do again sell, if you don't have an Active kit already, we do have one that we can provide you, and it will provide you with the drills you need, the screw taps you need, the parallel pins you need, the implant drivers you need, screwdrivers you need. So it has all the same aspects that the OEM kit has. And as a reminder, PureSwitch allows you to place these implants. You can use them with your OEM surgical kit or the DESS provided surgical kit, whichever one you have or want to utilize. You can use either. Again, all the surgical tooling is available for you: torque wrenches, the implants, the drills, screw taps, cover screws. We provide everything you'll need for that implant surgery from a tooling standpoint. Quick chart comparison, and this is where I'll talk about there's a couple of differences here that are not really major, and one of them is you probably noticed the machine collar on our active HEX versus the total surface coverage on the implant on the Nobel. And the reason that was done was some of these roughened surfaces, when they go all the way to the top, if you leave them a little extra crustal, super crustal, the super rough allows for bacteria to get there, and we all know tissue doesn't like it. Tissue doesn't like it, bone doesn't like it, and you end up with headaches that you don't want, and you don't really have that with a machine collar, or at least not to the degree that you have with a micro roughened surface like a TiUnite. And the other is the packaging, which we went through, which is our zero waste versus how Nobel packs their implants. Those are the two differences. Again, prosthetic wise, we have a host of options for you. If you're not familiar with our prosthetic options, we make these today and have made these for years for NobelActive. Everything you're going to need to restore healing abutments, scan bodies, transfers, impression copings, temporary abutments. We make locator abutments. We call DESS locks. Analogs. We make the full assortment of restorative products for you: tie bases, angle bases, multi-unit abutments. So whether you're doing a single unit or a full arch case or an overdenture case, we've got something that you can utilize. We make screws that are Nobel compatible. Again, use your Unigrip. You don't have to buy a new screwdriver. You don't have to buy a new torque wrench. All of the torque values are the same. We make, what they call the aesthetic abutment. We make pre-mills or blanks where you can, the interface is already there. So if you have the access to a mill, you can, mill your own custom abutments, or have your lab mill their own custom abutments. So all the restorative process parts that you would need. Drilling protocol, again, back to PureSwitch. You don't have to learn anything new, or it's the same drilling protocol. If you're placing active today, you can use that tooling and you can use it in the same fashion. So it's the exact same protocol, drilling protocol as you have with the OEM. So I'll take a second and go through the Straumann BLT, and again, we'll answer questions here at the end. The sound won't work, so you'll have to listen to my voice as I talk you through this time. So again, you see the internal aspects. The internal connection of the BLT is the same as the OEM. The design at the crustal part of the implant. Our surface technology, SLA standards. In the internal connection. Titanium it's made out of. Grade 4. And the threads are the exact same as bone level tapered as well. That's a visual of the implant. So again, same links, same platforms as the OEM brand. So you don't have to worry about, hey, I've been placing 3 3s in a 18 millimeter and you don't have that, or an 8 millimeter. We have, all the same, links and platforms as the OEM. Again, you can utilize your surgical kit with the OEM, or you can utilize the DESS surgical kit. Now, with the Straumann kit, there is one minor difference. So their Loxum comes with their implants, and as we were testing, we didn't have access to the Loxum, so we developed our own implant driver and an adapter. So those are the ones that we have tested. And so those are the ones we know work. So we have a surgical kit that includes these. If you have a bone level tapered kit, drills and everything are fine. We have tested our implant driver and the adapter to be able to place the implant. But we do not, we don't have testing on the Loxum driver. Now, we have certainly some anecdotal data from customers, but what we have tested is the DESS implant driver that comes with our kit. So that would be the only potential additional thing that would be outside of the pure switch concept, if you will. Again, surgical kit, all the drills, screw taps, your screwdrivers, cover screws, implant drivers, torque wrenches, they all come with the kit. Again, with this one, we have a different implant driver and an adapter to be able to place that. And then there's the Straumann Loxum, which just hasn't been, we haven't had the opportunity to test it. Drilling protocol is the same. So if you're accustomed to placing a Straumann bone level, there's no change to your drilling protocol. It's the exact same. Again, a chart showing the similarities here. There's they use titanium grade 4 as well, but they have an alloy mix in it as well. We don't have that alloy mix. That's one of the differences. And then the second is the packaging. Again, is unique to us with our zero waste implant. And then as we discussed, the implant driver potential difference that we provide versus Straumann. Again, I'm going to repeat myself here. Restoratively, we've been doing this for 20 years. We have a full assortment for you. So whether you're doing a single unit with a tie base, or a single unit custom abutment using a pre-mill, or you want to use a stock single unit abutment, or you're doing an overdenture case with locators, or you need multi-unit abutments for some type of full arch or a multi-unit on SRAs, whatever you need restoratively, we can provide here. And again, along with the screws, again, the torque values are the same as the OEM. So with that, I will thank you for your time, and I think I'm finishing pretty much on time. So I will turn it over to questions. If you have questions, you want to type them in the chat. I am positive I will not be able to answer them. But if I can't, some of my teammates here, I have our tech support and customer service teams on. So if I can't answer them, they certainly will be able to. So I will thank you for your time again, and take your questions.